Hello, my name is Claire Dobson. I'm a continence clinical nurse consultant, and that means that I see people with bladder and bowel problems. I work in the Bankstown area and I see people over the age of 65 years. Statistics from the National Continence Foundation of Australia estimate that 5 million Australians have a bladder control problem or a bowel control problem. That doesn't necessarily mean incontinence, but it can happen to anybody at any age, and it's never too late to seek advice. A bladder or bowel control problem doesn't necessarily mean incontinence. It could be urgency, it could be rushing to the toilet, it could be leaking a little bit when you cough or sneeze. But don't ever let anybody tell you it's too late. At any age this can happen, and it's never too late to seek advice and support for bladder or bowel control problems. Incontinence is a loss of bladder and bowel control, from a small leak to a total leak. Incontinence can increase the risk of falls, and how can this occur? If you have an urge and you're rushing to the toilet, that can increase your risk of falls. Acute illnesses such as urinary tract infection can cause incontinence, can cause delirium, and can cause confusion in some people. Medications can cause falls, particularly water tablets. Water tablets can cause urgency, and urgency can cause rushing, and then rushing can often lead to falls. Ask your GP possibly to check your medications. Some of the medications that you're taking, can they be changed? The water tablets that you're taking, are they a little bit severe? Have you been taking them for a long time? Can you take a less dosage that you're on right now? Get your doctor to check your medications. Reduce mobility. Many people have arthritis, rheumatoid arthritis or osteoarthritis. And if you have arthritis, that can reduce your mobility, it can cause pain, and that can stop you wanting to go to the toilet. Waking at night time. Sometimes people wake at night and they go to the toilet just for the sake of it. Oh, I'm awake, I may as well go to the toilet. But other people wake at night because their bladder actually wakes them at night. When you wake at night time, you're not quite as alert. You can be a little bit drowsy if you've taken sleeping tablets. So it's always a good idea to be very mindful when you wake at night time to have a night light and to take your time when you get up. I'd like to introduce you to some good bladder and bowel habits. Firstly, eat well. Try if you can to have 30 grams of fibre a day. Well, you can get that fibre from pears. Pears are the best fruit that you can have, particularly if you eat the pear with the skin. Oranges, potatoes with their skin, good fruit and vegetables, wholemeal bread, wholemeal Lebanese bread, wholemeal pikelets. Anything that has that fibre is good for the bowels. However, if you're eating fibre or you take a fibre supplement, you must make sure that you drink plenty of water. We want to drink well. Water is the best. Try and avoid the caffeinated drinks, cola drinks, tea, coffee. I'm not saying don't have them at all, but try and limit the cola drinks and tea and coffee. 1 or 2 a day is not too bad. But if you do have a bladder control problem, those sorts of drinks can actually irritate the bladder and the bowels. Exercise. Keep moving to prevent constipation. If you get constipated, a full bowel can put pressure on the bladder. You need to practice those good toilet habits and try not to go to the toilet just in case. The problem with going just in case, it makes your bladder capacity smaller and you'll go to the toilet more often. It's a good idea to always practice good seating habits on the toilet. This helps with bowel evacuation, and it's always important to, when you need to go to the toilet for your bowels, that you go at that time. Not always easy when you're out and about, but we should always go to the toilet when we feel that urge. If you delay that urge, that can cause constipation and can cause problems. So this is a diagram, a picture of how we should be sitting on the toilet. We should have our feet well supported, our knees slightly bent, slightly forward, and that's a really good position for bowel evacuation. I just wanted to explain about the pelvic floor muscles. It's probably an area of muscle that you haven't had to think about or ever had to think about. This pelvic floor muscle is in both men and women. How do we identify that pelvic floor muscle? Well, the pelvic floor muscle is a sling of muscle. It's like a hammock from the pubic bone to the tailbone, in the male and the female. You might wonder why we're talking about the pelvic floor muscles. The pelvic floor muscles are a supportive area that support all the internal organs. And as we get older, those pelvic floor muscles can weaken. In women, that can occur after childbirth and after menopause because we get a lack of estrogen, which keeps that pelvic floor muscle trim, taut and terrific. For men have pelvic floor weakness, particularly after prostate surgery, because that can damage the pelvic floor muscle. So this is why we need to really be aware of our muscles. It's a muscle out of sight, out of mind, but it's a very important area of muscles. What we usually say to be able to identify where that muscle is, when you next go to the toilet for a wee, try and stop your flow of urine. Those are the muscles that you're using. We say to people not to do that all the time because that's not good. It's good to just do it that once so that you've identified where the muscles are. And also, although it sounds a bit crude, try and stop yourself from passing wind. Imagine you were out in the cinema, or you were out shopping, or you were in the doctor's surgery and you wanted to pass wind. We don't tend to do that. You clench around the anus, not the buttocks, but around the anus, and those are the muscles that we're using as well. But how do we do these pelvic floor muscles exercises? They can be done lying, standing, or sitting. Get yourself comfortable and just imagine when you're lying, sitting, or standing that you're trying to stop your flow of urine or you're trying to stop pass wind. You lift and squeeze those muscles around the anus, around the vagina, and hold for up to 10 seconds if you can. Don't worry if you can't, because probably to start with you'll only be able to hold for about 2 or 3 seconds, but over time you might be able to hold for a little bit more. Keep your shoulders relaxed, keep your stomach relaxed, keep your thighs relaxed. We don't want you to hold your breath either. It's a lift and squeeze inside. And this is the difficulty because we can't see those muscles, but it's a lift and squeeze. How many should we be doing? Well, usually we say if you can try and do about 8 to 10 of these repetitions about 3 times a day, that will help. And often before you get that urge to cough or sneeze, to try and brace yourself and hold those pelvic floor muscles before you cough or sneeze, before you change position, because often when you get up from a chair or you get up from bed, a lot of people say that they desperately need to go to the toilet. Try and sit at the edge of the chair, try and sit at the edge of your bed, lift and squeeze, take a few deep breaths, do a few pelvic floor muscle exercises and try and get to the toilet. That will put the brake on. It's never too late to practice good bladder and bowel habits, and don't let anybody ever tell you that incontinence or bladder and bowel problems are a normal part of aging. It doesn't have to be.